financial year. Honorable members, before we proceed to introductions, please allow me to welcome our guests this morning. We have a stakeholder group all the way from Mossel Bay. I see the lovely group in the gallery, iconic Mossel Bay. Please feel welcome to the Western Cape Provincial Parliament, and thank you so much for joining us this morning. Please allow me, honorable members, to acknowledge Ms. Linda Brown, Clifford Seiden, Clinton September, Blendy Sumoro, Michaela Abrams, Lynette Solomons, Velma Boysen, Donay van Rensburg, Naslin Haynes, Dorothy Duplessis, Dawn Valentine, Lynette Meyer, Rosina Reuters, Marilyn Kannemeyer, Kelly Rousseau, George Witboy, and Matilda Kleinboy. Again, thank you so much for joining us this morning. And then the committee also received notice that we will have the Guguletu Health Forum in attendance. If you are here already, also feel welcome to our committee this morning. Nozibele Mdai, Nomalady Junchwa, Nsedu Sifumba, and Veronica Shumana. Thank you so much for joining us this morning. We are now going to deal with introductions. My name is Wendy Kaiser-Philander, and I'm the chairperson for this committee. We are going to proceed to members in the chambers. Then we will go to members online and then to Minister and the department. You may proceed, honorable members.
Good morning, Chairperson, and good morning to my colleagues, and good morning to the professionals, and good morning to our guest. My name is Memory Boyson, and I'm a member of this committee. Thank you.
Good morning, Chair. Good morning to the Minister and all stakeholders in the department. I'm Donita Stevens, and I'm a member of this committee.
Good morning, Chairperson, MEC, Administration. My name is Francois, and I'm part of this committee.
Good morning. I'm Thomas Walters. I'm a member of the committee.
Good morning, Peter Johnson, member of the committee.
Thank you very much, honorable members. We have, as I can see, 3 members online. You may proceed, members. Members online, you may proceed with introductions.
Good morning, Chairperson, Minister and his team, and everyone. My name is Rachel Van Vogel, and I'm an alternative member. Thank you.
Good morning, Chair. Good morning to the committee, MEC, and to the public. My name is Ayanda Barnes. I'm a member of the Provincial Parliament.
Good morning, Chairperson, and to everyone else. Aisha Kasim, I'm a member of this committee. Thank you.
Thank you very much, members online. We then move to Minister.
Thank you, Chairperson. Good morning to everybody in the chambers and to the beautiful team from Osselby. Welcome in the house as well. Oh, by the way, my name is Yakulon, Chairperson, and I do have the responsibility to be the Minister of Social Development. Thank you.
Good morning, Honourable Chairperson, Honourable Members, Minister, colleagues, visitors. I'm Robert MacDonald, Head of Social Development in the Western Cape.
Good morning all. Juan Smith. I'm the CFO for the department.
Good morning all. I'm Dean Wally, the Director for Finance in the department.
Good morning, Chair and honourable members. Charles Jordan, Chief Director, Children, Families and Vulnerable Groups.
Good morning, all. Patiswa Momoza, Director, Vulnerable Groups. That's portfolio includes persons with disabilities and older persons. Thank you.
Good morning, Chair and members. I am Zwandi Leo, Chief Director for Community and Partnership Development. Thank you.
Good morning, Chair, honourable members. Debbie Dreyer, Director, Partnership Development.
Good morning, members, colleagues. Liana Goosen, Chief Director, Social Welfare and Restorative Services.
Good morning, Chair and all members. I'm Ashwinette Jonkerman, Director, Facility Management.
Good morning, Chair, MEC, and honourable members. Bernard Lodgett, Head of Ministry in the Office of Minister Jakalond.
Good morning, Chair. Good morning, Minister and HOD and honourable members. My name is Monique Mortlak-Malgas, MLO for Minister Kulont.
Good morning, Chair. Good morning, members. Abdul Rauf Raycliffe, Director, Restorative Services. Thank you.
Morning, Chair. Morning, honourable members. Gavin Miller, Director, Research Information Management.
Good morning, Chair. Good morning, honourable members. My name is Petrona van Wyk, Acting Director, Operational Management Support.
Good morning all, Tasneem Rakib, Director Supply Chain Management within the department.
Good morning, Chair and honourable members. Siham Niftaquddin, Director Business Planning and Monitoring.
Good morning, Chairperson, members, MEC. My name is Annemie van der Renen. I'm the Chief Director for Service Delivery Management and Coordination.
Good morning, Chair. I was just skipped. So good morning, Chair. Good morning, honourable members. The name is Lionel Arnold, Director Community Development. Thank you.
Thank you very much. Minister and HOD, are there any officials online that you're aware of? None? Thank you very much. Then that deals with our introductions this morning. Honourable members, the purpose of the meeting, as per our agenda, is to deliberate on the annual report for the Department of Social Development. As I said, for the financial year 2024-2025. We have also received our material in good time. So I would really count on members' diligence and discipline this morning that when you raise your questions, please refer to a page. I think it would be sound for us to go section by section. And I know, members, sometimes it's necessary for you to sketch a certain situation to get to the question. But can I please ask you to keep that as brief as possible? I would allow questions, as I said, on the specific section and also allow, if need be, for a follow-up question on a certain section as well. I will now allow for Minister Lond to provide the committee with a brief remarks, some brief remarks on the annual report under review, Minister. And I hope that the 5 minutes that we give you are sufficient. Over to you, Minister.
Thank you, Chairperson. The 5 minutes should be more than sufficient. However, I do think if you truly want to acknowledge the work that the department's staff has done, we would need significantly more time. But because you all have a lot of meetings to get through, I'll keep it short. From my side, it has been a steep learning curve coming into the Department of Social Development. But the one thing that I can say with complete confidence is that this department is blessed with incredible staff. Staff that's willing to go above and beyond, available almost all hours of the night, and also staff that are willing to teach their skills that they have built up over the years. They're also willing to be innovative and finding ways in looking after the most vulnerable in this province. So when we do this report, it's not just the numbers that's on the paper. It is the 2,000 plus staff members that we've got in the department that do an incredible job. And those in the chamber represent all the staff that serve the most vulnerable in this province. So from my side, I do want to say thank you firstly to HOD, the chief directors, and all the other staff for the work that you're doing. It's often an unthankless task and job, and you get criticized a lot. But if you didn't do your job as diligently, we would have had a lot more difficult conversations in front of this committee. So to the committee also, thank you so much for holding us accountable. It keeps us on our toes. And it also helps shine a spotlight on where we can continuously strive to improve. And that's with that spirit that I'm also going to take that when matters are raised we will take it to heart, learn from it, and see how we can improve our services to serve the residents in this province and specifically those that need it. So that's all under 5 minutes, Chair.
Thank you very much, Minister Lond. HOD, anything that you would want to add?
Thank you very much, Honourable Chairperson. And I think just to concur with the Minister that this department is made up of an excellent team from the child and youth care workers and the social workers all the way to the chief directors. And also to thank the Minister as well himself for his leadership during the year under review. It's the first full year we've had with the Minister that we're coming back with the annual report from. So it's been a pleasure working with the Minister for this year. So thank you to him. And also just to also acknowledge we've got quite a few of our staff they've been really stretched this last year, and some of them are not doing so well. And just to just to say that our thoughts are with them with the difficulties that they've been through. Some of this, the committee's heard about the hijackings and the other things that have been happening. That's still happening. As well as staff really taking a strain on their health as well. So just to acknowledge that everyone's pushing themselves and that it's not an easy space we're working in. So I think also to say that the annual report generally reflects that we've met the bulk of our targets and spent the bulk of our budget, but there's so much complexity in there. And as the Minister said, we are open to looking at new ways of doing things and inputs from the committee, and we look forward to the discussion.
Thank you very much, HOD. Honourable members, I am now going to ask if you perhaps have any questions based on the input provided by the Minister and the HOD. Member Boyson.
Thank you, Chairperson. Chairperson, I want to concur with the Minister and with the accounting officer. And I think on behalf of this committee, Chairperson, we are aware of the strain and the dangerous circumstances which the staff are going through. There are shootings all over Cape Town. We read in the newspapers where the staff respond whilst there's firing in the areas. And we don't have a silver bullet solution for that, but we acknowledge that. And Minister and HOD, we are with you in this fight. We are with the staff, we are with management, and hopefully we'll get a solution going forward. But we are aware that it's tremendous stress and we feel for the staff. Thank you.
Thank you very much, Member Boyson. Any other member in chambers? Not? Any member online? No hands? Thank you very much. No hands. And indeed, HOD, our thoughts and prayers as the committee. I think I can speak on behalf of the committee, of those staff members, as you have indicated. Thank you very much. Honourable members, I will now officially table the annual report for the Department of Social Development. As indicated earlier on, we will be interrogating this report section by section and allowing committee members to pose questions to which the department will then respond. Honourable members, we are now at part A, which deals with general information, and you will find that on pages 11 to 35. If I can please have an indication of any member wishing to pose a question relevant to pages 11 to 35. I recognize or I note Member Stevens. I do not see any other hands in chambers. Member Stevens, Member Comfort. In chambers, any member online? No hands online. Member Stevens, you may proceed. Thank you.
Thank you, Chair. I just want to know on page 11, how many victims has been helped through the Ambassadors Program and in which communities this program was rolled out during this year? And what type of support is available to the victims or the family? As we did listen this morning on the news that another young girl was stabbed to death yesterday. Thank you, Chair.
Thank you very much, Member Stevens. When you ask your question, you actually mean for the year under review. Thank you very much. If Minister and HOD can please note that question. Member Comfort, please proceed.
Thank you, Chair. Page 11, paragraph 1, Chair. My question is simple, Chair. I look at the report of the Minister or the MEC, and I read it down and I compare it with the reality. Chair, my question is, and I will read it in Afrikaans, Chair. I hope all of us is aware, can understand English well as Afrikaans. Chair. My concern is daar in die provinsie, Chair, wil ek baie graag weet, stem ons saam as ons sê dat die toestande in sekere ouer huise het 'n afname in die sin, Chair, waar ons, as ons byvoorbeeld kyk aan die Kraaifontein probleem waar ons was of waar ons mee te doen is, moet ons wisse daar op waar gegaan het. Kan ons sien, daar is 'n afname, mense se omstandighede verswak by sommige van ons fasiliteite. My vraag is, wat het die departement in plek om seker te maak dat ons mense beter versorg by sulke tipe fasiliteite, sowel as die bestuur van so fasiliteite? Wat is daar om seker te maak dat dit nie kan gebeur en dat sulke persone verantwoordbaar gehou word? Dankie, Chair.
Ja, dankie lid Kamfer. Ek is jammer om nou vir u te ek wou u nou nie onderbreek nie. Net vir vinnige verwysing, kan u net aandui watter bladsy u na verwys?
Chair, page 11, paragraph 1. I read the report and I see the minister the good work, but what my concern is there is some of our facilities, there is some of problems. I refer to the Kraaifontein, for example, facilitate. That is our people there's problems in some of our facilitators. That is what I refer to.
Ek neem kennis, dankie lid Kamfer. Ons moet net in gedagte hou dat ons altyd spreek wat ons vra vandag vir die jaar onder bespreking asseblief. Dankie, dan gaan ek die departement geleentheid gee om die lede in die huis se vrae te beantwoord en dan gaan ek aanlyn. Dankie.
Thank you, Chair. So I will just make some introductory remarks, and then HOD or the CDs are welcome to fill in if there's anything that I have missed. Just to Member Stevens, what we have done now is there is now on the SWIMS app a tag that's being added, and Annemie can maybe just indicate if it's done already. She says yes. So then we can start tracking the referrals via the GBV ambassadors. At this stage, whenever something was raised, it was escalated, it was attended to, but because that tag wasn't on there, it was difficult to do that. So I think the member also submitted a written question to this effect, and you will also then get a similar response that we have now added that and should be able to better track specifically via the GBV ambassadors. And then obviously when a case is referred, the support from the social workers gets given depending on the circumstances of those individuals. Agbare Kamfer, daar is in Gigi Charles Jordan, Chief Director, sal vir ons kan net sê hoeveel, maar ek dink ons het meer as 100 ouer huise wat ons befonds, maar daar is net 'n handjievol wat op risiko is. En soos jy self weet, daar is nou iemand aangestel om te help die Kraaifontein huis om te keer. Maar daar moet ook besef word dat dit is nie net die departement se verantwoordelikheid nie. Ons moet ook sorg dat die regte mense betrokke raak, en dit is waar u ook 'n handspel, ek weet Member Stevens het ook 'n sagte plek vir Kraaifontein huis, dat diegene wat die vaardighede het betrokke raak. En 'n sprekende voorbeeld tot hierdie, ek bedoel ons het almal gepraat oor Vermont, en toe daar mense opgestaan, betrokke geraak, en kyk hoe ongelooflik het dit nou omgedraai. En ek glo met die administrateur wat daar nou in plek is vir Kraaifontein, tesame dan wanneer die AEV plaasvind en mense van die gemeenskap raak betrokke, kan hulle die Vermont voorbeeld volg. Maar wanneer daar wel probleme is, agbare kamfer, dan gaan die span in, hulle kyk daarso, hulle maak aanbevelings van die omkeerplan wat gevoer moet word. So dis net in kort vir daai.
Dankie minister. Tevrede, lid Kamfer? Member Stevens? Happy? Thank you very much. And then I will move online. Member Kasim, you may proceed.
Thank you very much, Chairperson. Chairperson, I'd just also like to do a follow-up on the ambassador program. I think the question from Member Stephens was which communities are these programs rolled out in? And then also above that, I'd just like to check how many communities in the province does this program cover? How effective is it? Do they produce any results? And how were those results measured and recorded, specifically related to the gender-based violence ambassador program? Thank you, Chairperson.
Thank you very much for the question, Member Kasim. I also just want to reiterate that your question will then obviously be based on the year under review, and the answer will then also be based on the year under review. Thank you very
Correct,
much.
Chairperson.
Thank you, Member. You may proceed, HOD. Thank you.
Thank you, Honourable Chair. I think Minister has already touched on the way that we're looking at measuring the program. Just to say that it's a virtually zero cost program to the department. So I think the measurement process is something we're building into our systems, and I think the what we're getting anecdotally already is very positive, but now we're starting to get numbers as well. So I'll just ask Ms. Van Reenen to speak to which communities and how many it covers, and what we're doing with measurement.
Thank you very much, Ms. Van Reenen.
Thank you, Chairperson. Currently, I'm glad to say that by the end of the year, we've got our service delivery areas, which is 45, 46. By the end of the year, each of those SDAs would have launched a GBV Ambassador program. We started off in the Malmesbury area, and then we moved over to the Delft area. We've also did one in Grabouw, Philippi, Heinz Park, Ceres, the Central Karoo district, which cover the Laingsburg, Leeugamka, Prince Albert, Maritzburg, as well as the Beaufort West area. Then we had one in the Ceres area. And then also our first one in the metros was the Cape Metro North region, which covered the areas Dunoon, Bishop Lywes, Langa, Elsies River, and Visantekraal. Then we had one in the Burke River area, specifically the Porterville, which the ambassadors came from. And then we had another launch in the Metro South area, which covered the Manenberg, Heideveld, Lavender Hill, Philippi, Steenberg, and Guguletu. In the Metro East area, we had Kraaifontein, Khayelitsha, Eerste River, Mfuleni, and Somerset West. Then we had another one where we covered the Bonnievale, Aston, Robertson, McGregor, and Zolani area. Klein Karoo, Oudtshoorn, it was people from Ladysmith, Calitzdorp, Duiselsdorp, and Zoar. And then another one in the metros, which we added on was the Retreat. More for Philippi, more for the wider Mitchells Plain area, also more for Guguletu, Wynberg, and then Mfuleni and Khayelitsha. What's the space in the next couple of months? So by the end of the year, the big impact that we can currently see is the one that's operating very well is in the Delft area, where we have already succeeded with 9 assisting with protection orders, as well as in the Heinz Park area, where we managed to get information and help 3 people succeeded with protection orders. Thank you, Chairperson.
Thank you very much, Ms. Van Reenen. Member Kasim, any follow-up question?
Nothing for now, Chairperson. Thank you.
Thank you very much, Member. Honourable members, any other questions on pages 11 to 35? I see Member Peter Johnson.
Thank you, Chairperson. Just a general question, which I think is mentioned throughout the first pages that we are discussing, pages 11 to 35. I think it's mentioned on a few different pages, the extreme shortage of social workers within the department. I would just like to know from the either the Minister or the HOD, I remember last year throughout the budget season, there was a clear indication from the National Treasury that they do not recognize social workers as frontline services or workers. Whether there's been any update going into the adjustment budget now, whether there's been any sort of indication if any of this might have changed ever since. Thank you.
Thank you very much, Member Johnson. Minister HOD.
Thank you very much, Honourable Chair. The question from Honourable Member Johnson, I think, relates to the fact that we don't have enough funds to reach the ratio of social workers we want to reach in the province, because the population is growing, our total number of social workers is not. The issue last year was that when there was a additional package of funding for compensation of employees that was distributed to provinces by National Treasury, they only considered the health workers and teachers and not social workers. And we did motivate at the time through the MINMEC that this be reconsidered and that social workers be recognised as an essential service. Thus far, there hasn't been any indication as to whether this is going to be taken up. It seems also that allocation the Treasury did nationally last year, it's unclear whether they're going to do that again this year. We actually have no sense of what the budget is even going to be next year yet. So I think those discussions may come up in the MTech process and the last part of the budget cycle, and we will continue to push it. But so far we haven't had any confirmation.
Thank you very much, HOD. Any follow-up, member? Thank you. I recognize Member Van Vogel.
Thank you, Chair. Am I audible, Chair?
Indeed, you are, member.
Thank you so much, Chair. Mine is on page 11, second sentence of the second last paragraph. I just wanted to check with the MEC. He highlights the rollout of the social work integrated management system, the SWIMS app, as a game changer. Yet many social workers, especially in rural municipalities, continue to struggle with connectivity, device and data costs. Can the MEC account for the actual reach, reach and functionality of the system beyond urban area centers, and explain how the department measures its impact on the service delivery outcomes rather than a mere system adoption? Thank you, Chair.
Thank you very much, Member Van Vogel. Can I please ask that you perhaps just check your connectivity as well, because at times your sound did come through a bit distorted. I just need to check with the HOD and Minister whether you got the question. Indeed. Thank you, Minister.
Yes, Chairperson, I got the gist of the question. And if there's anything unclear, Member Van Vogel can just ask again. I'll just ask the Chief Director van Reden to come in if I've missed anything after this. But the amazing thing, Member Van Vogel, from the beginning, this was set up to actually work in the most rural parts of the province as well. If you go and you take that road north from Beaufort and you go on that Loxton road out, and your signal drops, you can still work on the app. You can still capture the information. And as soon as you get back to the office or get back into connectivity, all of that information will be uploaded. And something that we have not communicated to the members, but I'll let Chief Director van Renen speak to it, because she's been pushing for that there's additional access that's now and connectivity being provided for the social workers when they do their work, and also for our NGOs. But Chief Director.
I think we need to remember the system on Chairperson works on.
Ms. Van Renen, your mic, please.
It is on. Okay, maybe I must sit a little bit closer. Chairperson, the system works on your laptop and on a smartphone. Minister explained the offline capabilities, but all our offices across the province has got connectivity. But what we have done, and it's in working from this week, I've asked that CI help us so that when you go to public Wi-Fi and you log into that there's no cap. They've confirmed from this morning the URL has been changed. So even if it's an NGO, because we're busy with the process of the rollout, they'll be able, wherever they've got the public Wi-Fi, to connect and exceed the data limitation. So that is what we've also done. But as Minister rightfully said, there's an offline capability as well.
Thank you very much. Member Binvogel, any follow-up question? Based on your initial question and response?
No, Chair.
Thank you very much, Member. Honourable members, this is the last call for any questions on pages 11 to 35. I don't see any hands in chambers. I do not see any hands online as well. That then
Chair.
deals with part A of the annual report. Honourable members, we then move over to part B, which deals with the performance information on pages 38 to 97. I see I note member Boyson. Any other member in chambers? None? You may proceed, member.
Thank you, Chairperson. Chairperson, my questions are based on page 38 and page 39, and my second question would then go to page 51. But Chairperson, page 38 and page 39 deals with sexual abuse, it deals with teenage pregnancies, and it gives heartbreaking numbers as well in terms of how many cases have been reported and how many cases the department is aware of. Now, Chairperson, my question is, I don't know how to put it, Chairperson, but I'm part of an undercurrent discussion regarding these matters. And the question is difficult in the sense that I know it cuts across many departments. It touches on health, it touches on other departments as well. Now, Chairperson, my question regarding teenage pregnancies between the ages, in this instance, between the ages of 10 and 19. Now, Chairperson, we know that that is statutory rape. And Chairperson, my question is, and I know that there's going to be an answer here, but it is something that I want us to go and contemplate as a department. My question, Chairperson, is when will we reach the stage where when an incident of an 11-year-old, a 12-year-old being admitted, whether it's through the Department of Social Development or Health, for being pregnant, obviously somebody has raped their child. And now, Chairperson, I'm asking that when will a case be laid when we become aware of that? And we all know that there are instances where they hide the pregnancies. These kids, they wear balloon clothes and whatever, and by the time the parents finds out, then they've already adopted a sense of preparing themselves for a grandchild, and they don't want to go and lay charges because they're now looking forward of being grannies. But then my question is, if we pick it up, who must go if the parents don't do it? I'm not aware of any department that has gone to the police and say, can we investigate? Something has happened to an underage child. I know there's not going to be an answer, Mr. Jordan, but I think it's something that we need to contemplate. But we do need to have the discussion through you, Chairperson. Even in health, somebody must do something, otherwise the scorch is not going to stop. Thank you.
Thank you very much, Member Boyson, for raising that very critical and important issue. And sadly, so sometimes in the cases that parents are aware, and these things are happening under their watch as well. Member?
Chairperson, my second is on page 51. The department refers to funding that are given to NPOs and NGOs for post-disaster humanitarian relief assistance across the province. And they give a number of 5. Now, I'm a district boy. My question then would be, is that split across the districts as 1 per district, for instance, because we have 5 districts apart from the metro? Thank you.
Thank you, Member Boyson. Is that your questions on that section? Thank you very much. I recognize Member Walters.
Thank you, Chair. But perhaps just to add some content to what Member Boyson was asking, the same issue came up in the health debate in the health committee, where the question was asked, well, when there's clearly underage pregnancy, why is there not a reference to the police? Now, obviously, with doctor-patient confidentiality, the mandate of the health sector, it's not quite such a clear case. And the answer they gave to us was, well, they usually refer it to a social worker. Now, they have their own social workers. There's some call it alignment issues there. But to me, the crisp question would be, to what extent are social workers geared to report this? What are the sensitivities around it? And at the same time, what's the cooperation with the SAPS in this regard, and that specific issue? Thanks, Chair.
Thank you very much, Member Walters. Any other member in chambers? None. And then I will just pose my question on assisted living and infrastructure. I think that reference is page 57. If the department can perhaps just give us an update, or rather, let me not go to update. The plan, what is the plan expansion for assisted living facilities for persons with disabilities and the elderly? And how is progress being monitored in the department? Let's deal with those few questions, and then I will see if there's any members online. Minister?
So I'm just going to make brief comments and then hand over to HOD. The one thing, and this is what I'm quite proud of, the NGO sector we have in the Western Cape. I mean, and HOD will elaborate on it, but the questions around teenage pregnancies, the process that's being followed, but also the post support is very important. And we visited an organization, Mustarafin, that does an amazing job with young teenage mothers, assisting them to finish their schooling, assisting them in getting pathways to be economically independent. So apart from what the department is doing, there's also these organizations that help with those pathways, and there's been some amazing testimonies around that. And then on the disaster management, and this is, again, credit to what the department does. Member Boyson, you correctly posed the question. We have a province that's quite broad, but the organizations that we fund are able to operate in all the districts, the metro and the 5 districts in the rural areas as well. And that is something that we identified last year, that there's a gap between when the support kicks in from SASSA and who fills that gap. And the department, together with the NGOs, has now stepped into that space. So Mr. Heu and his team, Franjo and them, have really done a good job. But to give you a bit more information on the first part of the question and on the latter part, I'm handing over to HOD.
HOD.
Thank you very much, Chairperson. I think while we're on the humanitarian relief, I'll ask Mr. Hayward to speak to the division of those 5 organizations.
Thank you very much, HOD, through you, Chair. Honorable members, the 5 organizations who have looked at the capabilities of the humanitarian relief organization in the Western Cape to service every part of the Western Cape, whether they've got a warehouse in each area of the Western Cape. They have staff and support vehicles. So we have identified it as far to be having such capabilities, and we have spread them. Some are doing 2 districts, for instance, because they've got capabilities. So in each and every municipal district, there is a humanitarian relief organization that supports that area. For instance, even in the metro, some of them are even doing the metro split 3 ways. Thanks.
Thank you very much, Mr. Chair. On the question of teenage pregnancies, the department is part of the Child Justice Forum and also Prov Joint. The forum is, as a task team at the moment, looking at the issue of teenage pregnancies, and they're looking at the roles of the NPA and SAPS in being able to address this. So the Child Justice Forum is made up of DSD Health, the SAPS, NPA, Justice, and others. So they're looking at working together at this stage to see how they can address this from an enforcement perspective. So it is on the agenda there. I think there are cases of teenage pregnancies that are statutory rape. Some aren't. If it's both children, it's not statutory rape. So you know, it really depends on the age of the male in the situation. The other thing is also that as Honourable Member Walters has said, there are some confidentiality issues in the health sector. But the other thing is that we are looking at getting the Department of Social, or rather the Department of Health social workers onto the SWIM system, so that also there's a more seamless reporting between health and DST when there are cases that come up. So that may also help us to identify where there's a need for a social worker to intervene. I think there are cases where there's prosecutions for children being impregnated, but in most instances that is happening where it's a act of rape against the wishes of the child. But it is correct that there's a lot of cases going under the radar where it may have been consensual, but there is an adult involved. And I think that's where that task team is looking now to see where they can close that gap in the system. The social workers are in a position to pursue a case together with the SAPS if there's been a violation of a child's rights and harm to a child through an act of statutory rape. So in principle, they can take action. But I think, again, it's a question of whether there's reporting of these cases, because a social worker may get involved if it's referred to the social worker. If it's not, then it may never reach us. But I think that's we are hoping to see some standardized approach emerge between the criminal justice stakeholders and the health and DSD role players, and we'll see what comes out of that and what the agreement is. The other thing, of course, DSD does provide support services to the families and the children who are affected by teenage pregnancies. And we also do teenage pregnancy risk reduction programs as well. So does the education department. I think that we need to look at the preventative as well as the reactive side of things. So we're looking at both aspects. In terms of the question from Honourable Member Falanda, the assisted living and the infrastructure, Chair, the department itself isn't building infrastructure for assisted living or for any facilities for older persons and disabled persons. Generally, we look rather to leveraging NGOs, funding them to use their assets. But there's also the special needs housing policy that we've now moved to a point where we've got organizations that are being, I think that, I'm not sure what the term is, maybe Mr. Jordan will help me with that, but organizations like NOAA that are being recognized as being, which is an independent living focused NGO that are being recognized now as participants in the special needs housing programs. So I'll ask Mr. Jordan just to speak a little bit to the latest on that development and any other developments that are relevant to assisted living progress.
Thank you, HOD. Mr. Jordan.
Yeah, thank you, HOD. Thank you, Chairperson. Yeah, so it is the special needs housing according to the special needs housing policy, of which some independent living applications from NGOs have been approved by social development. It's now being handed over to Department of Infrastructure, the branch human settlements, because they need to supply the capital. So it's not many projects that was approved in the Western Cape. It depends on when they submitted it, and we've approved it. Going back to the concept of independent and assisted living, at this stage, the department itself is not looking at expanding because it's budget constraints. So if there's more financial input being provided via Treasury, then we can expand those services. But at this stage, we can't. If you look at the special needs housing policy, that, as I said, the department or the branch of human settlements are responsible to fund that capital. It does not come from the budget of social development. Thanks.
Thank you very much, Mr. Jordan. HOD.
Thank you, Chairperson. I think to say that at the moment, the bulk of our funding and goes into the more acute care kind of situation. So we're focusing on funding old age homes, especially frail care for clients who really can't assist themselves. And also with disabilities, we fund, for example, 7 child and youth care centres for children with disabilities as well. So the department's current funding model is more geared towards the more severe cases and facility-based care as opposed to independent and assisted living. We want to move away, not move away from that, but we want to supplement that with more assisted and independent living because that can reach more people and it costs less. But obviously with the budget constraints, as Mr. Jordan mentioned, at the moment it's very difficult for us to expand into that space as much as we want to. So we're going to have to look at different kinds of partnership models where we can achieve that with minimal budget, or alternatively we have to make a stronger case to National Treasury to start supporting this. We recognise that there is a growing elderly population in the Western Cape and in some of the other provinces as well, and we are preparing a motivation to the Finance and Fiscal Commission to say that they should start taking this into consideration in the equitable share division between provinces, because the ageing population carries with it significant financial implications for governments generally, and it's something that's practiced around the world. So we are hoping to motivate that there is more consideration given to the cost of an aging population. And if we are able to get that right, then we can push further into the expansion of assisted and independent living, because that is a cost-effective way of reaching a lot more people. But at the moment, as I say, we're more focused on specialised, because those services we have to render, their people are very vulnerable. So we can't get away from that. Charles?
I agree with HOD. It's extremely costly, as you all know, to support an old age home or even independent assisted living. There's infrastructure involved, there's maintenance involved, so it's quite a expensive exercise. Your old age home should be exclusively actually for frail people, not for people that's very healthy. The spirit of the Older Persons Act is that an older person should stay within the community as long as possible. So the focus should be within the next 10 years, not so heavily maybe on assisted and independent living, but at home-based care. That is the issue that's been missing. If I look at Department of Health and Wellness program of home-based care, they don't specialize in home-based care for older persons. It's generic home-based care they do. Home-based care, you need specialized carers being trained that can look after older persons. It's going to be more cost effective. We can do more outreach. For example, some service centers, clubs, and even some old age homes that already do those outreach programs to the communities. Not many, but that should be the way forward, going with the Older Persons Act and the specific issue. Thanks.
Thank you very much, Mr. Jordan. I think all members' questions in chambers are covered. And then I had a question on the SWIMS rollout, especially in our diverse communities within the Western Cape, but you covered me perfectly. Thank you very much, Ms. van Reenen. And perhaps just on gender-based violence and restorative services as well. I know we already spoke about the program and the expansion thereof. Perhaps just give us some insight into the strengthening of the intersectoral coordination with SAPS as well as the justice system that will ultimately, hopefully, improve the referral process and also ensure that survivors can receive that holistic support, please. Thank you.
Thank you, Chair. I'll ask Ms. Goosen to speak to that question. Thanks.
Thank you, HOD. Ms. Goosen.
Apologies, Chair. Can you just repeat the short version of that?
Okay, so the question was can we provide some insight into the strengthening of intersectoral coordination on GBV? So how is the intersectoral between SAPS, the justice role players, and other stakeholders? How is that going, and how is it strengthening GBV programs?
Yes, that stakeholder engagement is set in formalized structures, both in terms of the various forms of GBV, trafficking, as well as the shelter movement, as well as psychosocial support services in general. And we have set forums for that in order to take this forward. There was some challenges in terms of the different stakeholders' management of trafficking in persons. And we also had to smooth that over. So at this stage, I must say the way the Western Cape is operating in terms of the sectors is unique, because in the other provinces, the other stakeholders totally disengaged from this.
Ms. Goosen, perhaps just a follow-up. Auntie van Woolsley that is listening in or watching us this morning, that specific forums that you are talking about, who is actually represented on those forums, and also in terms of SAPS and the justice, are they part of that forums, and what, to holistically support a GBV survivor?
Okay. In terms of, for instance, the on-the-ground frontline, the area-based teams are doing that, who consist of the local police and SAPS and health and social development. And then the ambassador program is one of the support systems to identify and to provide immediate direction in terms of what services are needed. So if there's a specific area where this does not operate fully, then we need to know that so that we can ensure that we focus on that specific area. But on a provincial level, that structure is working very well with each other.
Thank you very much. Ms. Goosen, HOD.
Thank you, Chair. I think also I'll just ask Ms. van Reenen to speak to the local integration and the role of the GBV ambassadors.
Chairperson, we've got the victim impact forums, victim empowerment forums, where we work with SAPS, the local SAPS. So if it's the auntie of Woolsley, it's her SAPS in Woolsley. And then we've got health there, education, the municipalities, all of those that comes together. And where the GBV ambassadors is, they also work at the victim rooms in the SAPS local police station. And we have monthly feedback meetings with the ambassadors. But all those stakeholders on an intersectoral level come together quarterly to discuss all the issues. Even if we do the 16 days of activism, you bring them all together. What we also have in the districts is with the Cape Winelands district municipality and the Eden Karoo, we've got meetings where the municipalities and all the departments comes together and discuss what is the current issues, and then also they give us the ABT feedback, what's happening in the area. So that's how we collaborate. I must say, in the last couple of years, we've come very close and worked very closely to tackle the issues in an area.
Thank you very much. HOD?
Thank you, Chair. I think just to mention also that there's other things like the tutors, care centres and things that offer institutional integration as well, where the different stakeholders come together. And I think that's being rolled out quite extensively too. And then the one-stop centres and so on that are being introduced. So there's a lot of local integration developing, not in all areas yet to the degree we want to see it, but it's come a long way in the last 10 years.
Thank you, HOD. Ms. Goosen?
If I may add, we have embarked on a geo-mapping of the province to see where there is a prevalence of GBV in order to prioritize our services and our scarce budget accordingly, so that the higher prevalence areas, is prioritized for where we place services. For instance, TCC centers, of which we have 10, shelters, as well as then the psychosocial support mother bodies from the NPO sector. That's complemented by what DSD is doing in terms of the ambassador program, which is more across the board. So that the aim of the regions in terms of the ambassador program is to roll it out so that there is one in each district. But in terms of our funding model currently, we must make work with limited funding and address the priority areas.
Thank you very much, Ms. Goosen. Perhaps just my final follow-up. What I didn't hear quite clearly is in those discussions and forums and the work that's been done, I can't hear clearly where the justice system fits in. I mean, that is often the big concern and the frustration that perpetrators are not brought to book soon enough. Are they part of that discussions? Thank you. HOD and then Ms. Goosen. Still
Okay.
need be.
I think, I mean, they are part of it, but there's the victim-friendly rooms that have been introduced, and then there is also the sexual offences courts that are being rolled out. So there is movement there, but I think the focus up until now has been more on the first response, and DSD's been the lead on that. But I mean, the fact that we've got now the NPA leading the Tutuzela centres and they help with the prosecution process, and we've got the Victim Support Services Bill that's soon to be an act that sets out specific support that must be rendered to victims during criminal justice proceedings, and then the sexual offences courts and the specialised focus on that. I think that is the kind of main thrust from the justice side. I don't know if you want to add, Ms. Goosen.
I think we should differentiate between Department of Justice, which is the administrative leg sort of the courts and all of that, and then the NPA, which is the prosecuting leg. In terms of the NPA, I must say there's a concerted effort as well as a commitment from their side to address protection orders, prosecution and so on, so much so that they withdraw mediation as an option for any type of prosecuting action where there's a victim due to gender-based violence or which sexual offences is one. Secondly, with that in mind, the prosecution must continue unless there's one or other problem with the victims. We've seen the other day that we, for the first time, had a very young victim that led to a successful prosecution, because the rule of thumb is if they're younger than a certain age, it's no use proceeding with prosecution due to the fact that the victim can't testify unless there's other secondary things. In terms of justice, it's a bit more challenging. They administer, for instance, the sexual offences register, and for anybody, for us, any public official, any person that employ people that work with children and so forth, must be vetted against that register, but it costs money for that entities to do the vetting against that register. And the resources on a provincial level, it's done from a provincial office with, I think, 2 or 3 staff members here in Justice. And that is a challenge. So the vetting process as a prevention and deterring method can't fully work.
think of all the educators in the province, all the social workers, all hospital staff that needs to be vetted just in the public sector, and then forget about the private sector that still also have to do that. So that's one of the main concerns as a preventative factor. And the second thing is the fact that the court rolls are so full and judges, magistrates is not, they're not fully employed in terms of all their vacancies. Makes prosecution a very long and long process. So victims forget dates. And we even seen in disciplinary matters that if the victim is not specific on a date and time, we lose that cases. And then in terms of the protection orders, they are starting to digitalize that. That's certain courts now, so that the application at least is without waiting in a queue. I think there's a pilot currently in Mitchell's Plain. So the application part and the administrative beginning part is digitalized, but it still needs a person and a prosecutor and a witness to get that final one. I think we get quicker the initial protection orders before that, but not the final protection orders as a result.
Thank you very much for that insight, Ms. Goosen. No members in chambers. I see no hands. Can't there no members in chambers? Obviously, you're here. I don't see any hands. I then move online to Member Kasim.
Thank you, Chairperson. Chairperson, mine is based on Part B's, the performance information in Part B. I just wanted to check why does it...
My apologies, Member Kasim. Do you have a specific page in that section?
I don't have the book with me. I'm currently in Johannesburg, but I took the notes from the book. So it's based on what was in the book, on the performance information specifically.
Please proceed, Member.
No problem. I just wanted to check, why does the department set itself low targets on each of the programs provided? And then also, when it comes to the achievements, it's like they overachieved on most of these programs. But then when it comes to the sub-programs dealing with, for example, the distribution of sanitary targets to schools, the department fails and blames tender delays instead. And then also, let's look at the sub-program dealing with the number of adults in conflict with the law. The target of the department is just over 5,000, and then the achievement is over 12,000. So the question that I have, in a province where the prevalence of the crime is so high, including petty crimes, why is the target in those sub-programs so low, but the achievement is very high? The same question go to children in conflict with the law, gender-based violence, and other cases. So I just wanted to check, was the target not supposed to be set higher, judging by the crime stats revealed each quarter relating to the Western Cape? Thank you, Chairperson.
Thank you very much, Member Kasim. HOD. Or Minister, you going?
Thank you very much, Chairperson. So I think the targeting, we've tended to target based on what we projected based on prior years. So sometimes we end up with quite big fluctuations in outcomes. And some of these targets are very unpredictable, very difficult to be sure what we're going to see coming through to us. For example, with people in conflict with the law, adults in conflict with the law being referred through the courts for diversion programs. Some years we've undershot because the courts have had more serious cases and they haven't seen those adults as being suitable for diversion and rather looking straight to the prisons. But in some years we have higher numbers of adults who are eligible for diversion. So it's quite unpredictable. It's not really something that we can be 100% sure of. So I think that when it comes to our targeting, we've also had to consider the budget cuts that have been coming through and keep our targets relatively in line with what we expect to get funding for. So where we've been able to exceed targets, it is often due to innovative methods where we've been able to get more than expected clients through, or just due to the fact that, there's by chance there's been more people than usual. It's not really, it's very hard for us to target a lot of things. The one thing we can target properly for is the Sanitary Dignity Project, because we knew how much money we needed for how many sanitary pads, and we did target fairly specifically for that. But unfortunately, the tender process during the year under review did not produce a suitable bidder. So we couldn't award it, and we had to then go back to another process that did then delay the procurement and distribution as we had planned it. So then we ended up not meeting the target on that one. So I think, look, by and large, we've never had big issues with meeting the targets on the Sanitary Dignity Project, but this one was more of a timing issue combined with the fact that we couldn't appoint a bidder. So we had to restart the process from scratch. So I think that's the only major hurdle that we experienced with the target that we had some direct control over. A lot of the other targets we don't have much control over. So I don't know, Mr. Hill, if you want to add to the issue, and then I see Ms. Quiston would also like to add.
I think that you covered that, Judy.
Thank you very much, sir.
If I may, in terms of the crime and GBV and so on, we are also dependent on the approach by other departments. Our sister departments, for instance, Justice and the NPA, on their stance on certain crimes. This time they go harsh on crime, and very little diversion is required from us, and then suddenly they change and say prisons are overcrowded and we must look at diversion. So and because it's a court-referred service, we're sort of playing catch-up from prior years on what is the priority. In terms of diversion specifically, we had to reprioritize our service providers and the funding that we have. It's a very small program. We have about 15 million allocated to that. And to deal with, for instance, with this service, we initially only had 2 service providers that renders diversion programs. Now we have 9. So the output can be more based on the increase in referrals. But again, it seems to be, we must plan with last year's stats for the next year, and then suddenly they change their tactics or approach.
Chairperson, I think if you look at the diversion figures, they fluctuate quite a lot year to year. So one year it was 9,000, then it was 12,000. So I think we're looking now, we're getting around the 12,000 mark. And then also with the children as well, it's up and down over the years. So I think we base our targets on more or less what has been the average over the last 5 years or so, just to be safe. Because to be honest with you, it's quite hazardous targeting too high for in terms of the new DPSA system, because if we don't meet a number of targets, then as an accounting officer, then I'm in the dog box for failing to meet a percentage of targets. And when we have so little control, it does push us to go for the riskier targets for lower or riskier outputs. We rather go for the lower targets, so we don't get penalized, for something we have no control over. But I think also in terms of GBV, we have seen quite a sharp uptake of services with the GBV Ambassadors program. It's made people more aware of the services. So we had unexpectedly high turnout of victims coming looking for help. And that also then means we end up with a lot more people than we had projected. But I think it's always a dilemma with social development. A lot of our targets are actually projections, really. And there's some targets we'd rather not meet. I mean, it's not like we want to have a lot of children in conflict with the law, but we have to be able to account for how we use resources. So we need to include these as targets, because that's the system that we're working with. We have to call them targets, and we have to account for the money like that. So yeah, it's not an ideal system for this department. It may work well in an infrastructure context or in a other kind of project-based context. But yeah, it's not an easy fit.
Thank you very much, HOD. Honourable members, I do not see any further hands in chambers nor online.
Chair,
That
my
we-
hand is up, Chair. My hand. I'm not sure.
Member
Sorry
Van
for
Vogel.
Thank you, Chair. Sorry for
Member Van
interrupting.
Vogel. I did
Yes,
not
Chair.
notice your hand. Please,
Okay.
if your hand is not showing, please do chat in the chat function that you wish to ask a question. Please proceed, member.
Thank you so much, Chair. Sorry for that. I will try next time. Chair, my question is on page 38. I think one of the members previously asked the question, but my understanding was when you look at the point of reference, the unemployment rate for the first quarter of 2025 was 90.6%, according to the General Household Survey of 2025 in Western Cape, where the adequate access to food food security remain are very high in the province. So my question to the minister is, despite the department's own acknowledgement that 80.1% of Western Cape households experience food insecurity, only 22,128 vulnerable persons access meals through department centers. How does the minister and the department justify this cross mismatch between the scale of hunger and the department's limited reach, and what targeted measures will be implemented to ensure that social relief programs are not just symbolic, but reach the hundreds of thousands of households facing hunger and malnutrition. Then lastly, Chair, my last question is on page where it's HIV. Just
Can you
checking
please
now.
refer to the page, member? Which
Page
page?
39, page 39, paragraph 3. Another pressing issue is the rising of HIV prevalence. So I want to understand, while overall HIV prevalence has declined, the report reveals an alarming doubling of HIV rates among adolescents between the 15 and 19 years, from 3.5% in 2017 to 6.7% in 2022. This is a disturbing reversal that points to policy failure in youth-targeted prevention and education. What has gone wrong in the province? Social behavior change and youth empowerment program. And does the department accept that the current approach is failing to protect young people, especially in poor and rural communities? What is being done to address this matter moving forward? Thank you, Chair.
Thank you very much, Member Van Vogel. I assume the last question conjuncts with another department, but I'm sure HOD or the minister will indicate as such based on the response thereof. Then I give over for response, Minister.
Yeah, Honourable Member Van Vogel, it is a problem that is not just being grappled with by one department. We deal with this across departments. You would also now know that the new pilot project that the Minister of Health and Wellness have launched to tackle stunting with mothers that's at risk of giving birth to underweight babies, or when actually give birth to underweight babies, to step in there to make sure that interventions are done there. The Department of Education delivers over 500,000 meals per day to learners. And then there are NPOs that do an amazing job. And we've actually expanded our services in Laingsburg recently to get concentrations of communities. But as the member correctly points out, we do face with the challenge in the province, and we will continue advocating that we get funding to help tackle this even more. So it is not just a one department challenge. We deal with it. We now have a subcommittee, the Educated, Healthy and Caring Society, that also grapples with that. So it's important for the member to also look at how we approach this holistically and not just look at the numbers for one department. And then the second part of the question, actually, if you can assist there, thanks.
Minister, HOD.
Thank you, Minister. Chairperson, I think the food insecurity stats speak to the household income situation. But we have to consider SASSA, the role SASSA plays in alleviating that, alongside, as Minister mentioned, the full scope of programs in the province, like school feeding schemes, the Department of Health's nutrition schemes, DSDs. So we are a contributor in a sense. We fill in the gaps where the other bigger systemic solutions are not reaching. So where SASSA is a much bigger budget for this province. I think they put about 10 billion worth of, don't hold me to it, but I think it's about 10 billion or more that SASSA puts into this province for grants. So that's already 4 times our budget in total as a department. And then the school feeding schemes that the Department of Health runs reach 500,000, as the Minister mentioned. And all of our old age homes, our disabled homes, they're also providing food to people. The ECDs reach about 70,000 children. They provide food each day. And then our feeding schemes are really basically assisting people who are still with those various safety nets in place, not fully covered. So we supplement what is happening. We're not the solution as a department. We are a player, and not the biggest player either. We're just one of the players. But I think the reality is as well that we forget the role of civil society as well doing this, because during COVID, for example, with the food relief that we were doing, it still didn't actually even reach the magnitude of what the NGO sector was doing without government funding. So the NPO sector and private donors are covering a huge amount of this need as well. So we need to look at the picture holistically, but one of the areas that we particularly focusing on, as Minister mentioned, in the transversal committee, EHACS committee, as a social sector cluster, is looking at child malnutrition, stunting, and so on as a particular priority area because of the lasting impact that has on a child and a child's life as they go into adulthood. It affects their learning, it affects their development on all levels. So there is a intention to really drive that harder, and there is a project that's coming that's going to be focusing on that, which is spearheaded by Health. So there is more happening in that space. I think the question around the HIV prevalence, there is a current process underway to try to reconfigure the approach to HIV prevention and management in the province after the withdrawal of the USAID project that's had quite a big impact on this sector. There was billions going into HIV prevention and management programs from USAID. So there's a big hole left, and the departments are now trying to reconfigure their approach in partnership with the municipalities, the civil society, private sector, and so on. DSD does work with Health on the programs. We support with things like the medication defaulters and things like that. And we are busy with social behavior change programs as well that are funded with earmarked allocations. Those programs, some of them were funded by USAID, and we've had to find other means of supporting them. But there are some of the programs that we funded prior to USAID with our own allocations, which we're still funding and which are still continuing. So those social behavior change programs are particularly aimed at teenagers and younger people. The overall picture, I think, has been quite affected as well by the aftermath of the COVID disaster. There's been a general downward trend in people seeking medical assistance, including vaccinations and the adherence to antiretrovirals, among other things. So that we've been set back in the fight against HIV. So I think in terms of the projects going forward, I mean, I think the health department remains the leader in the space of addressing HIV in the province. Their community health workers are a very important part of that project, and we support where we can as social development. But we, again, are playing a support role, not a lead role. So I think it's important to put that in perspective. Thank you, Chair.
Thank you very much, HOD. Member Van Vogel, is that a follow-up question or a new question?
It's a new question, Chair.
Thank you very much, member. You may proceed.
Thank you, Chairperson. Chair, my next question is on page 41. I think the point of reference referred to a total of 7,082 sexual offences. But I think the minister have touched on that or the HOD. But the report shows the department has only about 26 shelters to support victims of GBV, despite over 7,000 sexual offences reported annually in the Western Cape, and spent approximately 70 million on victims empowerment. How does the department justify running its GBV program largely as a tick box exercise while failing to provide sufficient long-term social support, adequate shelter space, and meaningful intervention for victims? Given the scale and severity of the crisis, what concrete plans and budgetary commitments exist to expand both shelters and other services to ensure that victims receive real protection and rather than minimal compliance reporting? Chair, then the second question, page 42 and 44, service delivery improvement plan. I want to understand if, can the department provide reasons for not achieving the desired standard of service on a number of key services as outlined on the table? Then, Chair, my last question is on page 48. The minister, MEC, the report indicates that the department's vacancy rate stands at 29.5%, nearly 3 times higher than the GSA norm of 10%. While the departments failed to spend over 30 million earmarked for compensation of employees, can the MEC and department explain why so many posts remain unfilled? What systematic or managerial failures have contributed to this persistent high vacancy rate, and who within the department should be held accountable for this underperformance, given the direct impact on service delivery to the most vulnerable in the province? Thank you, Chair.
Thank you very much for the questions, Member Van Vogel. Again, can I just ask you to please establish that you have a stable connection? I cannot constantly ask for repeat of questions. So if the department did not get the gist of your, I think it was 3 questions, I will ask that you please submit that in writing to the department. I am going to hand over to the Minister and the HOD.
Thank you, Chairperson. So I did right at the beginning, I said that the department is doing a lot with the limited funding that we've got. And I understand the members' frustration where it might appears that not enough is being done around fighting gender-based violence, but this department is the lead department. And I mean, it's not even our own metrics. There's even international metrics that has set us apart from the rest of the country. We are the leading province in providing support in fighting gender-based violence. We recently stepped in partnership with the Tewaterskloof municipality and opened up an additional shelter. So from where we're sitting, yes, more can be done as a province and even as a country to fight the scourge. But what we are doing within the funding, I'm actually quite proud of what the department is doing. If there's suggestions from the member on how we can improve within the budget that's available, then the member is more than welcome to submit that. We don't have any 10 years. We will then listen to what can be done within that space. But there's also, if you look at the bed space, and this is where maybe Chief Director Goosen can come in. Some parts of the years, there's not even full take up of all of our space in the shelters. Then you get to other periods, it's now actually the peak period coming up. Then the bed space are fully taken up. But overall on fighting and what we're doing within our budget, I'm actually standing with the department and proud what they are doing within the available resources. I'm going to ask Chief Director Goosen to just come in there if she wants to do anything. And then on the DPSA, I mean, the HOD can explain the regulations and the rules that they've put in place. It is a frustration that we can't fill our positions as quickly as we want. But from our side, and I'm having that conversation with the HOD, that we do everything from our side to ensure that the holdup is not with us. And make it as quickly as possible. But that again is something that we will have to look beyond the department to see how we can speed up. If Leona can
Thank you
come
very
in
much.
there and then HOD.
Thank you, Minister. Ms. Goosen.
Thank you for the question. If we look at the performance over the past 4 years, 5 years, the uptake for psychosocial services in GBV increased by around about 7,000. And it goes with the question whether we underestimated previously. It moved from about 18,000 to 25,000. So it's 7,000 more victims that receive services. That victims have a choice in terms of the basket of services, of which shelters are one. And some victims, due to their circumstances or the fact that they are economically functioning in a certain area, do not take up shelter space. So the shelter space is what is for those that are destitute and are victims in a combination. And we therefore look at putting the shelter as close as possible currently within the province to the victims, and therefore our priority was the opening of the 6 shelters that resulted from the infrastructure made available by National, and we've launched that successfully over the past few years. As Minister said, we also expanded that service within our current budget framework. More money is not coming forward. We're working smarter, and therefore a lot of our services are community based. It's definitely not a tick box here in the Western Cape. We have the GBV strat plan that all the provincial departments are involved in from their different sectors, whether it's education, health, and social development. So we're one of the partners in that, and therefore we should look at holistically what services are available and what the victim select to take up. It will never be enough. And we see that from the daily news and what goes on. But within the budget constraints and the resources available, we have substantially expanded the uptake of our services.
Chair, thank you.
Ms. Goosen, HOD.
I think also just to put it into perspective, in 2015, 2016, we had a total budget of 25 million for GBV victim empowerment services. Now our budget is 71 million. So it's increased by a lot. So I think it does demonstrate our commitment to GBV services and victim empowerment services. I think also to say that in terms of shelter capacity, we lead in the country. The Gender Commission has actually acknowledged the Western Cape as such. So I think the province, as Ms. Goosen said, it's not yet enough, but we've gone further than any other province, and the GBV Ambassadors Program is the first in the country, probably the first anywhere, where we've also been able to leverage significant capacity without even having budget. It didn't require budget to do that. So it's an innovative approach that multiplies DST's capacity to respond. So I do think that we are going in the right direction. But of course, there's still a lot to do. There's not shelters everywhere we need them. There's not Thuthuzela care centres everywhere we need them yet. So there's still room for more work to be done. But this movement has been quite rapid. And I must say that the Victim Empowerment Program Office and the director in charge have really been under quite a lot of strain, because they've experienced an increase in budget, but without increased capacity. And same goes with the regions as well. The regions have taken on the role of coordinating GBV ambassador programs without any additional capacity to do so. So I do think that they are stepping up as they need to. The budget, though, of course, will always need to be more. I think the question on the vacancy rate. That the vacancy rate is the rate of posts that we don't have funds to fill. It's not the rate of funded posts. So we have funded vacancies and then we have unfunded vacancies. There's a lot of vacancies in the department that are unfunded because there isn't enough money. And one of the reasons behind this is that when the department was restructured back in 2010, the provision was made for community development practitioner posts on the establishment, a large number of those posts, as well as an expansion in social auxiliary worker posts. But shortly after the restructuring process was done, the budget crunches started to come one after the other. And we therefore, as we couldn't fill those posts that we created as we planned to. And ever since, everyone will know, it's just gotten worse. So we are at the point now when we are going to have to look at actually changing some of those posts to social worker posts or social auxiliary worker posts, because we will never be able to afford to fill all those community development practitioner posts. I think in the interim, what we did do, because we had such a lot of pressure on social services or social work services, was we actually had around nearly 150 social work graduates that we appointed additional to the establishment that were funded to supplement our social worker cadre. But we're hoping we can start to add those posts to our structure as time goes by, and they will then take over, or we will try to swap out the community development posts that are unfunded for those posts as social worker posts, because they pay basically the same. But the envisaged rollout of community development in the province is not going to be as possible as the way it was initially envisaged. I think the other issue with unfunded posts is that we have had to keep quite a few posts from being filled during the year under review, because we were instructed by the Department of Public Service and Administration that we must fund only the most essential posts. We had to get approval via the Premier to fill non-OSD posts. And those were like all the administrative posts, supply chain posts, all the various types of non-specialized service posts. All of those had to be run through the Premier's office for approval, and so we had to ration our posts. So there was a lot of administrative posts that weren't filled during the year under review because of these very strict DPSA controls in place. So that also led to us having an increased vacancy rate of posts that we normally would have funded, but because of the severe constraints, we had to hold back. And that also led to us having underspend in our COE. But we understood the reasoning behind the DPSA requirements because they hit a very serious wobble last year with the national budget, where they predicted that we were going to run out of money, as everyone will recall. So that was the conditions that were put in place. They have been lifted now. So we are back to a lower level of control, but I still, as the accounting officer, have to certify every post we fill is affordable. So there's still some requirements, but the requirement of holding back so many posts has been lifted somewhat because the budget situation has eased slightly, but it's still very tight. So that is where we're sitting at the moment. And the problem is also that when we had that freeze on or not freeze, but partial freeze on posts, now that we can fill them, there's a lag in terms of filling those posts because it takes time now to start to find people for all of them. So yeah, I think it's been a pretty difficult year for filling posts because of these constraints. Thanks.
Thank you very much, actually, for the extensive response. Member Winvogel, I see your hand. Is that a follow-up question or a new question?
No, thanks, Chair. It's a type of follow-up because I'm not sure my question on page 42 was it touched on.
Thank you, Member.
42,
Actually,
and then
Thanks, Chair. Yes, sorry. These STIP outputs that were not achieved. I don't know how whether there's time to go through all the detail. Maybe Ms. Niftachedin can speak. Is it Ms. Goosen's one? Okay, I'll just ask Ms. Goosen to speak to that.
thank you, HOD, Ms. Goosen.
I have a hearing problem. It seems like I can't hear today anything.
Member Winvogel, do you mind repeating the question on page 42?
Yes, Chair, can you hear me?
Yes, we can. Your sound
Yeah.
is coming through a bit distorted, but we'll see
Is it
if
related
the
to the
department can.
underperformance?
Ms. Goosen,
Is
would
it
you
Yes.
like me an opportunity to engage with Member Winvogel?
Yeah, I want to understand from the department if they can provide reason for not achieving the desired standards of service on a number of key services as outlined on that specific table, 42 and 44.
Okay. The the reasons are indicated in the column, and for a lot of that training, we dependent on national. That due to budget constraints, limited the rolling out of training within the province because they also sit with the same budget environment that we do. Secondly, we've expanded our total number of probation officers in the province. So we have those that are experienced that do not need the necessary training, and then that's this graph is relevant to the to those that we recently onboarded. So and the improvement plan is until the end of this financial year. So it's a 2-year plan. So we're about halfway there, and we hope to, through the assistance from national, increase that achievement totals. Thank you. Sorry, I really struggle to hear. Maybe I must sit closer.
Thank you very much, Ms. Goosen, for your response. Member Winvogel, is that a follow-up question?
That's my last question, Chair.
Please refer to the page, member, and proceed.
Page 62, sub-program 2.5, social relief. I just want to understand from the department, can they perhaps provide detailed explanation of why the target for the distribution of sanitary towels was not achieved, and how much is the tender for this project, and why must it go out on a tender when there are so many NGOs that you can partner with for free distribution to schools? Thank you, Chair.
Thank you very much for the question, Member Winvogel. I will ask the department to please respond based on the year under review, please. Thank you.
Thank you very much, Chair. I think we did speak to the fact that the tender process wasn't able to agree on a suitable tender bidder, so it had to be redone. The amount of the tender, I'll ask Mr. Hewu to quickly get that number for us for that year. The question why it needs to go out on tender, the National Treasury issued a circular a couple of years back, Circular 21 of 2019 was 2020. It was 2019, yeah, 2019, which was set out a framework to distinguish between when departments can fund NGOs for certain things, what we call transfer funding, and when procurement processes must be used, goods and services funding. So the difference between transfer funding and goods and services funding was primarily down to the question of whether or not the funding was going to be requited for the department. In other words, whether or not the department would receive some kind of benefit or service. Now, the sanitary pads essentially is a question of buying sanitary pads and having them distributed to schools on behalf of the department. Because that's a service for the department, goods being procured for the department, the legal view is that it must be done through goods and services funding. It's not funding of furtherance of operations for an NGO. It's funding for a service for the department, as well as goods being bought for the department to be distributed. One can argue that it's also for the benefit of the public and it shouldn't be seen as being for the department, but the Auditor General doesn't see it that way. So unfortunately, that means it must be a tender process by law, and we can't fund NGOs to do that. We had a similar run-in with the Auditor General around the procurement of food parcels, where we narrowly escaped adverse finding on the fact that we funded organizations to distribute food parcels, because we argued it was for the public, but they said it looks to them like we are procuring something when we should have followed a tender process. In the end, we agreed that it was unclear and that they wouldn't give us findings, but they said going forward, they're going to tighten that requirement. So we are finding that when it comes to things like this, they want it must be a tender process. So I'll ask Mr. Hewu if he can just speak to the question of what the amount was.
Thank you, HOD. Mr. Hewu.
Thank you very much, HOD. Through you, Chair. The amount was about 11 million, Chair. HOD, I just want to emphasize and probably clear the fact that yes, the tender was delayed, it was re-advertised and awarded. It was already awarded before the end of the last financial year. And we are currently running, the supplier started the first deliveries of the in the new product this in May, June this year. And now we are busy with the third quarter deliveries because we wanted to ensure that we do deliver the pads before the start of the matric exams. And we are busy with that process. And I must say that our supply chain unit was very innovative as well, because during the rerun of the tender, we had to request schools that were experiencing similar challenges with the pads, and we supported them to, we advertise using the electronic purchasing system, getting the quantities that the different schools needed, and the schools were able to get those pads, and they were able to deliver them to the girls that were in need. So although that the tender was not running, so there was some innovation and proactivity on our part to ensure that those needy indigent girls are able to get the product. But for now, with the 13 million that we have, we are already running and delivering without fail. And we've increased the school from 430 schools to 701 schools that are now going to reach supported by the PEF. Thank you very much, Chair.
Thank you very much for that positive contribution. Honourable members, I do not see any further hands in chambers. I do not see any further hands online. Perhaps just before we go to the next section, I am going to ask the two gentlemen at the back and the lady at the back. We also just need to know who you are for the record as well, please. Thank you.
Morning, Chairperson. Warren Wilson, Department of the Premier.
Good morning, Liesel Barron, Department of the Premier.
Good morning, Honorable Chair. It's Liaison Zamela from Auditor General. Thanks.
Thank you so much. And again, welcome and thank you for being here this morning. Honorable members, we are then part C of the annual report, which covers governance, pages 100 to 120. This section is dealt with by Scopa, but committee members are allowed to ask questions, obviously giving reference to the relevant page if you do have any questions. Otherwise, it's meant for this afternoon. Can I have an indication? Are there any members that wishes to pose a question? I see Member Boyson and then Member Stevens.
Chairperson, mine is a naughty question.
Hmm.
On page 111, the expenditure is 99.8%. Are there any lessons learned or improvement?
Thank you, Member Boyson. Member Stevens.
Thank you, Chair. Mine was from page 100 and then 104 to 105. I just want to know what major risks were identified in 24-25 and how does the department address these risks, especially fraud and corruption in grant systems and inaccurate or incomplete beneficiary data. Thanks.
Thank you very much. I do not see any further hands. Over to Minister and HOD.
Thank you. I'll answer the first question in the spirit that it was posed to us. So the number one lesson, but I think Member Boyson must please put that, and I'm glad there's members from the Premier's office and also finance. It shows that if you entrust with a little, you spend it well. So you can trust us with more, and we'll also make sure we spend it well. HOD, you can do the second one, please.
Thank you very much, MEC. Ideally, we would have wanted 100% expenditure. I think the main issue again for the year is, as always, it's COE. It's not really spent. It's our year in, year out. And the one lesson from that is more flexibility we have around COE, the better. Treasury has been assisting us with that and allowing us to reprioritize some of our COE to assist the NGOs. So we did reduce our underspending a little bit through that, which was good because we don't want to see money having to go back when we have such a dire need in our space. The question from Honourable Member Stevens, the major risks that were identified, particularly around fraud and the incorrect or inaccurate donor information or beneficiary information, rather. I think there's a whole lot of risks, and one of the big risks that come up has been staff safety, which is just getting worse and worse. We have seen a slight reduction in incidents this year of hijacking compared to last year, but it's still very high, even though we've been able to do some things to try and mitigate that, but it's not, we're not able to stop it entirely. The other thing is obviously the service delivery demands outstripping our ability to meet them. That is a huge risk for us, and we are quite overwhelmed with that. The other aspect as well is our inability to meet statutory requirements. The department has certain legal obligations, especially towards children. And if we fail to meet those, then we will find ourselves on the wrong end of a human rights case or litigation or both. And that for us is probably our most severe risk that we take extremely seriously. Last year, we had to repurpose one of our drug treatment centers to accommodate children instead because of the pressure on children being placed into secure care. So now we have a drug treatment center that accommodates children from the secure care environment that go there for treatment for underage children, because we're getting so much pressure from the court to place all of these children. So that was quite overwhelming. And then also within our foster care space, our foster care numbers are just growing extremely rapidly. We've spoken about this many times, but I mean, if you look at it before COVID, we were at around between 30 and 35,000 cases at any given time. Since then, we're at 43,000 cases in our foster care system, which is placing a lot of pressure on the staff. So these are big risks. We have introduced things like swims to try and improve productivity and efficiency and free our social workers up from red tape. And also better manage these increasingly large numbers, because it's becoming administratively very challenging. And I think that's part of the NFT story as well. You know, the need to, or the beneficiary information, capturing it accurately, managing it accurately, that SWIMS is aiming to assist us with, because up until now we still do have a highly manualized process of checking the client and beneficiary information. So we're trying to increasingly digitize that to create a more powerful and cost-effective system of checking non-financial data. So I think, you know, there's a lot of other risks as well that are flagged in there. You know, we've got a systematic approach to risk management, where we have a risk register and a set of management actions designed to address those risks. But there are certain risks that are outside of our control, and the budget risk versus demand for services and versus our statutory obligations is the most pressing one. Yeah, thanks, Chair.
Thank you very much, HOD. I recognize Member Windvogel.
Thank you, Chairperson. Chair, on page 102, the last paragraph where it reads, risk inadequate human resources within DSD to deliver on department strategic mandate. In respect of this, I have been made aware of serious staff shortages, especially for social workers, which lead to high expenses for overtime. Can you tell us more about this risk? Can I also ask for the department's comment on reports that there are overtime claims from March 2025 and some from last year that have not been paid to date? Thank you, Chair.
Thank you very much, Member Windvogel. HOD.
Thank you very much, Honourable Chairperson. So I think the inadequate human resources does speak to what I spoke on earlier, the tightening of controls on filling of posts, the fact that our structure is not increasing to meet the population growth, and then on top of it, the very long lead time it takes to fill posts. I think on top of that, we also are seeing the increased workload, and that is resulting in a lot of overtime being generated, which is a cost in and of itself, and it also results in burnout. So we are looking to see how we can increase our posts within budget availability, but I must say it's an uphill battle. DPSA doesn't want to see the public service expand, and they've made things very difficult for us to be able to do this. The question regarding overtime claims not paid, I think there have been some instances of delayed overtime claims not being paid. I think it's there may have been some disputed items, but I'll just check with my colleagues if anyone. Ms. Goosen is sitting closer. So.
Yeah, I can hear you now, actually.
Ms.
Sorry, it comes with age. In terms of the overtimes in arrears, there was some disputes, and we also had a subsequent dismissal due to fraudulent claim. So that held back some of the claims, but I don't think there's any challenges at the moment. Thank you.
Thank you very much, Ms. Goosen. Ms. van Reenen, you want to add?
Maybe I just want to add, although our vacancies look high, we also had social work graduates working back their bursary application, and there was over 100 in the department, which some of their contracts ended. So that you can't put in the document like this because they are additional to the establishment and not on your approved structure. On the overtime, I think where the high volumes came from January to March last year, we loaded all the old cases, which was active cases on the swim systems. So that was also a high influx of overtime. And one of the things that you see on a coal face level also is the high after hour work. The numbers that are coming through the call center has increased drastically. And also then the removal of the children. So you compare that sexual offences, all those removals and the children in the foster care, you can make that connection, the increase in the numbers. And a lot of those things happened after hours. And then in terms of the foster care supervision, to strengthen that, and also our investigations when we remove a child, is a lot of the time you need to go after hours because parents work during the day, so you need to go and do that after hours. So that's the slight increase. But all the overtime has now been paid in this financial year.
Thank you so much for providing that insight as well. Honourable members, I do not see any further hands on this section. We will now suspend proceedings for a comfort break and return at 10:30. Thank you. You will find a glass of cold water in the members' lounge. Thank you. Please let us reconvene 10:30 sharp. Thank you. All honorable members, and welcome back, Minister HOD and the department. We now resume our session. Part D of the annual report refers to the human resource management, pages 122 to page 168. I will now allow for any members that has got any questions on that particular section. Please indicate so. Whilst the members gather their thoughts, can I perhaps just ask in terms of human resources and capacity? I think we have noted, I think it's page 134, in terms of the resignations. I also note that it's quite the younger age group of people that do resign. I think it's 30 years to 39 years. There's also quite a high amount of resignations, and also there's an amount, or rather the 47 is the amount of resignations that did not provide reasons. If the department can perhaps just outline your specific strategies and timelines being implemented to retain skilled social workers, particularly in the rural and the high need areas of the province, to ensure that the service continues, as well as, of course, seeing the essentiality of this specific service. Thank you. HOD.
Thank you very much, Chairperson. A lot of the resignations are made up of people who are also getting appointments at higher posts. So they resign from their existing post to get a higher post, like social workers are appointed as social work supervisors, or they are appointed in as policy developers at head office. And then also there's the social work graduates. Quite a few of them were appointed in permanent posts, so they resign from their graduate, which is a 4-year contract post. They resign from that post to be appointed in a permanent position. So not all the resignations are people leaving the department. A lot of them are promotions, but we don't talk about promotions in the public service because that concept doesn't actually, strictly speaking, exist. So I think the retention concerns are sitting at the higher level posts in the department. We're seeing particularly difficulties in retaining people in things like supply chain, internal control, and also in the more skilled social work categories, the social work managers, social work policy managers. So there's quite a good career path option for social workers and community development practitioners as well, because there's also community development supervisors and managers roles, although less so because we don't have as many posts funded for that, and also the child and youth care workers. I think the highest staff turnover we're sitting with is probably in the child and youth care worker space, because that environment is quite a tough environment, and a lot of people don't always want to stay there. A lot of dismissals in that space as well due to assaults on children, because they get into altercations with the children, because some of the children are quite challenging to work with, and then they retaliate. But I think if we look at retention overall, the salaries are quite competitive, especially the OSD salaries for social work professionals, so that we are able to attract and retain social service professionals quite well. But it's actually more in the other areas that we're a bit concerned, particularly in finance skills and in the senior posts. We're also battling to find suitable candidates for SMS posts. We have quite a few SMS vacancies for that reason. But I think the bulk of resignations is from actual promotions.
Thank you very much, HOD. Members in chambers, any questions on the section pages 122 to 168? Part D of the annual report. Member Comfort, Part D, Human Resource Management, pages 122 to 168. I do not see any hands in chambers. Member Comfort, you may proceed.
Thank you, Chair. Chair, I see I read the pages, and it is page 133, tabel 342. That is about the persons the resign, and I think it's a contract workers. My concern of my worries is 21 of this staff have resigned. What I will check by the department is this 29 workers, is there a specific time that he must work in the department before he resigned? Or is it a contract workers? Or what was the reason that he resigned? That is my question I read, and I am worried. It's a lot of workers that he resigned from our department. And then also, Chair, I see the department have re-advertised on page 1, we're doing a recruitment on page. Wait, let me wait. It is further that Chair announced.
Is that in the next part?
Yes, let me.
So, Member Comfort, you did say page 133, table
133, table
3.4.2.
342, yes.
Sure. Thank you very much. Minister HOD.
Thank you very much, Honourable Chair. I think the reference to the 28 social work graduates who were reappointed on a permanent basis, the social work graduates would normally have a 4-year contract to work back their obligations in terms of their bursary. So when they got a bursary, it was for 4 years of study, and then their obligation is to work back the 4 years. They don't have to meet that obligation if the department releases them from that obligation. So the department can release them from that obligation. So if they work for less than 4 years and they are successful in applying for a permanent position, then they can still be placed in a permanent position in the department, even if they haven't completed the 4 years. But it's quite nice that we have a chance to see how they work and everything before, if they're actually appointed permanently, so we can see if they fit with the department and so on. So we get quite a few good candidates from this process.
Thank you very much, HOD. Are you covered? Thank you very much, Member Comfort. I do not see any further hands in chambers. Any members online? No members online. Honourable members, then the next part is parts E and F, which deals with financial information, and it's also dealt with by Scopa, pages 170 to 249. And you will find the annexures on pages 266 to 269. Honourable members, I do not see any members of the public. I also have not received any notice of any submissions being made to the committee this morning. If the procedural officer can please confirm.
No submissions, Chair.
Thank you very much, honourable members. In the absence of any further questions, we've dealt with the annual report interrogation this morning. I will then now ask Minister Lund for some closing remarks, and if any, HOD Dr. McDonald as well.
No, Chair, from my side, it's just an appreciation, and also to all the staff that joined us in the plenary. So you have a lot of work to do, but the fact that you offered up a few hours to also be here and be ready if any questions came your way, it's appreciated. So from my side to you, Chair, and the committee members, thank you.
Thank you, Minister.
Thank you very much, Minister and Honourable Chairperson. We appreciate the inputs and questions from the committee. Yeah, I think also just to say thank you once again to the team for being present today and assisting with the answers. Thank you very much, Chair, to you for also convening the session.
Thank you very much, HOD and Minister. On behalf of the committee, please allow me to extend my sincere thanks and appreciation to you and the department for the exceptional work that you are doing. And I think we do welcome the annual report for the 2024-25 financial year. We were indulged with the highlights in terms of the critical investment that you place in child welfare, gender-based violence, and community development at large. We are also remain vigilant, I think, as a committee and as the watchdog, to ensure that these investments ultimately transpire into real change that positively affects our communities. So a heartfelt thank you from our side as well. Honourable members, if there are no any further comments, I now look at Member Poison. You are welcome to do so, member.
Thank you, Chairperson. Chairperson, through you, we are 99.8% happy.
Absolutely. Thank you very much, Member Boyson. Thank you to our members for your indulgence this morning, as well as our members that have been joining us online. The administration or procedural staff has made provision for lunch. If you are perhaps able to return at 12:30, you are most welcome to do so. Please also allow me to extend a heartfelt thank you to our very capable procedural officer, Mr. Monde Jamke, for your support and all the preparation that went into this morning, and also to you, Ms. Mary Ann Burgess, and all our administrative and staff working behind the scenes to make this morning possible. Thank you very much, honourable members and Minister, HOD Department. This meeting is officially adjourned. Thank you.
you.